So this is what we need to look at. We've done a lot of research with the Ruby Payne research on poverty and kind of worked on that with students because there is that mindset. I just can't breathe all the time. I don't have asthma because I'm tough. And I'm just not going to acknowledge that I have it, so it's not there. So we need to really take a look at this and weave it into the things that we've learned about poverty. This is Northern Middle School. And 2007, it's our brand new school. They completely redid the school. It's fabulous. If you go in, the blinds, if you would not have curtains, the blinds are all within the glass so there's no dust. They looked at asthma triggers. They looked at the ventilation. It's a beautiful school. This is Swan Meadow, built in 1963. And Swan Meadow is an Amish school. And they're also a middle school. Most kids end in 8th grade. We have a lot of support from the Amish community. And you would think that maybe they wouldn't have as good a care as the other students. They have a wonderful parent who's an ICU nurse that I used to work with that's an Amish parent. And if it wasn't for Curtis, they probably would be. But he's been such a great advocate for immunizations and for asthma. But when you're looking at this community, you're talking about all the triggers, you got to think of the whole of Garrett County. We have horses and cattle. We have a principal that keeps her dog under the desk. So just working with that, changing that mindset. This isn't a therapy dog, you know, that there are learning those asthma triggers. Unfortunately, in that brand new school, that's going to stop. So, so that getting that mindset that what a trigger is and what asthma is, it isn't just, oh, it's asthma. It can be, a child can die from asthma, and you could be helping that child get there. And this is Kitzmiller School, which we were going to close this year and didn't close, 1923. Now you can only imagine this school building. And when I wish I had a picture of Garrett County when we had the 5 feet of snow on top of the roofs and they were desperately trying to bring in crews to take the roof off and get all that snow off the roof and the leakage. Now you want to talk about mold. But because of asthma-friendly schools, and Jim Thomas, our maintenance person, was so vested in this and had those signs up and is teaching his maintenance people in a different way and is really interested in changing all this. He's getting in there drying out things very quickly. If it hadn't been for asthma-friendly school, it would have been, it'll dry. But it really had made a difference in the maintenance. But this is a building which I don't know if Kitzmiller will be there next year. But just look at these beautiful Northern Middle School and the kids there and the kids in Kitzmiller. And this is down near Luke where the paper mill is. And it's right on the water on a river, right beside it. You can't see the river going through. So it's really a lot of triggers. And it's a small community, all older homes. So our new plan in place, access to care. Because we now have Power School this year coming up, when we have in there, their healthcare provider is in, so we have a database of healthcare providers and their addresses. So if they are in Pennsylvania or they're in West Virginia, we can now send out a letter, and we have the ability to also to have an automated phone message to parents for things that we have going on or to those healthcare providers. We can track our healthcare visits. We can see what students have chronic diseases, look at their absentee, and it has a wealth of codes. So we'll know, it won't be perfect, but we'll know if it was a personal day, whether it was a field trip, exactly where they were. And we can track it without the time it took that was not successful at all. And we can track the graduation rate and our attendance rate. And knowing how much time they've actually spent in the health room is time lost from classroom. When you get into secondary and high school, they need that time to graduate. If they're in the health room, they are not getting that class time for graduation requirements. So that's kind of what we're doing in Garrett County.
Okay, we have about 10 minutes left. One thing that I just wanted to bring to everyone's attention is that the program that Rebecca spoke about in terms of asthma-friendly schools, we're actually in the process of replicating that model to develop a program for children under the age of 4 called the Asthma-Friendly Child Care Initiative. Now, with all of the detail that Becky gave you about the committees and the meetings and the phone conference calls and all of that, we were able to develop the Asthma Friendly Schools Initiative in approximately 6 months from start to to implementation. I think we started in about January, and we're able to implement the following school year in the fall. With asthma-friendly childcare, it's taken us quite a bit longer. We are in the process now of beginning a pilot, which will begin with the formative development of or the final development of the forms, and we're hoping to begin that pilot officially in early fall. But one of the biggest issues with the child care program is the environments in which child care centers or family-based child care exist. In schools, one of the people that Becky highlighted was their maintenance worker. And that maintenance worker is really a key person on your team in terms of developing asthma-friendly environments. So you have your healthcare providers, you've got people who are providing education to families, but when it comes to controlling the environment, you really need that champion to help you with your maintenance and all of the addressing of the asthma triggers. With childcare, the problem is that they are all small businesses. And so we don't have the same level of regulation about certain things within the environment. So we had to go beyond what the Office of Child Care required in terms of the health and safety requirements for child care in order to be able to get the environments to really meet some of the best practices in controlling asthma triggers. So those of you who have, say, Head Start programs in your jurisdictions, or if you are school-based folks, if you have Head Start programs, Judy centers, or you may have healthcare providers who are working very closely with your programs. Those 0 to 4 population, it's very important for you to find out, are they in child care? What kind of child care provider are they going to? Is that child care provider providing any type of education around asthma for the very young children? Is that child care provider doing anything in their environment to try and reduce asthma triggers? And so I just wanted to put that out there so that those of you who have an interest in learning more about asthma-friendly child care, visit the Maryland Asthma Control Program's website in about 3 months or so. We should have all of the information up there so you can begin to work with folks who serve these very young children in the child care environment. And so I think we still have a few more minutes, so if anyone has any questions for the panelists, we have time for a few questions. Yes.
What about child care in independent homes?
That is part of the Asthma-Friendly Child Care Initiative. We will be piloting in approximately 5 family child care homes, and we know they have somewhat slightly different regulations, but again, we'll be looking at whether or not removing carpet is appropriate or changing cleaning methods for the carpet so that we can reduce dust and dust mites in carpeting. And so this initiative is across the board in homes as well as in centers.
Did you find in your experience parents that have pets and they rather give the medication to the child and keep the pet? Did you see that? I have seen a lot. I'm from
Yeah,
I don't know how to advise.
Well, one thing that I can say is that for the asthma-friendly child care, there are 10 criteria, and one of them is eliminating pets in the child care environment altogether. So if you have a family child care home, you can choose to say we're going to have a pet-free environment. Now, as far as counseling families, I'll let the two of you maybe talk about that.
I think you're right that it is very, very challenging. One of the things that I've learned the hard way is that for many families, the pet is their first child and the newborn child is the second child. I mean, I had a family with a preemie, and they wanted to know if they could have the baby in the bed with the dog, and so there's so many ways to go. But I think the important thing is that people have a love for a pet, and so what we've tried to do is say, clean sleeping areas. The pet and the child shouldn't be sleeping together. If you can keep the pet outside, the more time the pet is outside, the less pet dander there is in the house. Keeping a space that is pet-free. The pet can't go in the basement where the kids play or in the bedroom where the kids sleep. And as last recourse, getting rid of the pet, which is very hard, and it does tear families apart. And I think one of the things that's really hard is that the kids have a fondness for the pet, and then if my family had to give away the pet for me, then in the other siblings are mad at that child, it creates a difficult dynamic, and it's similar in some ways to the smoking. I say if you really love your child, you shouldn't smoke around your child, and the parents also say, yeah, I know it's really hard. But you say if you really love your child, the cat shouldn't be around your child. That's a lot harder. So it is definitely a big challenge. I always tell people it may not be the same, but a reptile like a lizard or a snake, they tend to be very low allergen because they don't have the fur. Not as cozy as a dog or a cat, though.
That asthma action plan, I mean, it sounds like a great idea. I think the majority of my students, they receive their doctor's orders from just their pediatricians. I don't see the pediatrician. I've seen one, I think, asthma action plan. It wasn't even in my year. It was in their chart from a previous year. So, I mean, I wish, I'm thinking like a pulmonologist would probably be more, apt to fill that out, but these pediatricians, are they gonna be doing that?
Well, it's getting them to change that mindset that all we need to know is you have a rescue inhaler, that we need to work with the parent, the school nurse, since we see the student a lot more than the 7 minutes they're going to see the student, that we all need to work together, and there needs to be that conversation. If they're using the rescue inhaler all the time at school and nothing else, then there's a problem. So whether it's on that piece of paper, we kind of, we would love to have the action plan filled out and used. Right now we've been taking anything, it's a kind of comprehensive plan, and they are far and few in between, unfortunately.
We've been trying to do a lot of education with providers on the asthma action plan, and you are absolutely right. People are very resistant, and I think it's the time thing, and that's where often if you can really rely on the team, the nurse, the medical assistant, have the PA or the NP work with the family, who else is going to do it, because there is a lot of resistance to filling it out. But I think we're getting there, and I think people are understanding the importance, but hopefully 5 years from now, this next conference, you'll say that you're seeing more of them.
We have time for only one more question. So I saw her hand first. I'm sorry, maybe afterwards you can come and ask your question.
Yeah, I have a question, and this is to Rebecca. How can your initiative, the Asthma Friendly School Initiative, how can this be promoted to other school districts like Baltimore City, Baltimore County? How can this get out to other school districts? Because in Baltimore City, we do have a large population of children with asthma, and it sounds like the program that you all have in place is working. So how can that be trickled down to the other districts?
Well, I think and Cheryl can talk about the logistics of this, but I think, and what we've tended to do now, first we went system-wide, this is what we could do. It's by each school, because as you've seen of our schools, they're very, very different. And I think we need to take ownership. When we took initially the plaque back to the schools, the teachers laughed at the school nurses, and they were going, oh yeah, look, this needs clean and that needs clean. But they totally missed the point. They've started to realize that it's their intervention, sending the kid down to be pre-medicated with their inhaler before they go to gym class, is making the difference that they don't miss the rest of math afterwards because they're sitting in the nurse's office. They need to see the benefit, and they are part of it, that everybody has a part in it. And I think if it can get one school in the district to be a success, if you could, we certainly didn't come in and go to the superintendent and Cheryl say, we're going to do this in all the schools and this is what we want to do. And now it's pretty much this year we sent them in. I'm sure everybody's not going to be the same level, because some nurses or some schools have been more open to this or that, have moved a little faster. It's got to be individualized by that school.
It's really a pleasure to be here. As Cheryl said, I am a family nurse practitioner, and I usually don't need a microphone because I have a big voice, but I'm happy to use one. I have the luxury of being able to work clinically and seeing day in and day out what happens in a federally qualified health center in Silver Spring, Maryland, where I work with low-income population, with children with asthma, as well as sort of working on the big picture part of it at the Association of Clinicians for the Underserved. And I want to spend my time talking to you about my presentation, not so much about my organization, but it would be helpful to me just to know who here is in a clinical setting, including a school or a school-based clinic? About half the group, okay, great. And who's heard of a patient-centered medical home? A little less than half. Okay, that's good to know. What I'm going to present to you today is sort of the role of the patient-centered medical home in asthma care and how it ties into all the work all of us and my colleagues on the panel are doing in the community and in schools. And just to give a very simplified definition, the patient-centered medical home really is a health home. If you kind of think back to maybe when you were young or your parents were young, sort of the family doctor who knew everybody. I had the